This medication is used to treat vaginal yeast infections. It helps to reduce vaginal burning, itching, and discharge that may occur with this condition. The medication is an azole antifungal that works by stopping the growth of yeast, fungus, that causes the infection. The vaginal product comes in two forms, a vaginal cream or tablet. Some products also come with a skin cream to be applied to the area around the outside of the vagina. If this is your first vaginal infection, it's important to ask your doctor before using this medication for self-treatment. This medication only works for vaginal fungal infections. If you have fever, chills, flu-like symptoms, stomach/abdominal pain, or a bad-smelling vaginal discharge, do not use this medication and contact your doctor right away. When using Monistat 7 cream with Applicator, it's important to follow the directions on the product package. If you have any questions, consult your pharmacist. If your doctor has prescribed this medication, use it as directed. This product is for vaginal use only. Wash your hands before and after use, and avoid contact with your eyes. The dosage is based on your medical condition and response to treatment. Use the medication usually once daily at bedtime for 1 to 7 nights depending on the product used, or as directed by your doctor. If you are using the single-dose tablet, it may be used during the daytime or at bedtime. If using the vaginal cream, follow the package instructions on how to fill/use the applicator with the cream. Insert one applicator filled with cream into the vagina as far as it will comfortably go. If using the vaginal tablet, you may use either the applicator or your finger to insert the tablet. If you have itching/burning around the outside of the vagina, apply the skin cream to that area usually twice a day for no more than 7 days. Continue to use this medication every day for the full time prescribed, even if symptoms disappear after a few days or if your menstrual period starts. Do not use tampons, douches, spermicides or other vaginal products while using this medication. Tell your doctor if your condition does not improve after 3 days or lasts more than 7 days, or if your infection returns within 2 months. You may need a different or additional medication to treat your condition. If you experience symptoms such as headache, vaginal/urethral burning/itching/pain, or lower abdominal cramps while using Monistat 7 cream with Applicator, it's important to notify your doctor or pharmacist. Your doctor has determined that the benefits of using this medication outweigh the potential risks of side effects, as many people using this medication do not experience serious side effects. Although rare, a serious allergic reaction to this drug may occur. Seek medical help immediately if you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects. If you experience any other effects not listed, it's essential to contact your doctor or pharmacist. If you're in the US, you can call your doctor for medical advice about side effects, or report side effects to FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can also call your doctor for medical advice about side effects, or report side effects to Health Canada at 1-866-234-2345. Before using Monistat 7 cream with Applicator, make sure to tell your doctor or pharmacist if you are allergic to it, or to other azole antifungal agents. This product may contain inactive ingredients that can cause allergic reactions, so it's important to talk to your pharmacist for more details. If you have diabetes, immune system problems, or frequently experience vaginal yeast infections, consult your doctor or pharmacist before using this medication. It's important to discuss your medical history and any health problems before starting treatment. Before undergoing surgery, be sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are using this product, you should ask your doctor about whether it is safe to have sexual intercourse. Monistat 7 cream with Applicator may weaken rubber products and lead to failure, so it's important to use alternative forms of barrier protection or birth control during treatment and for 3 days after treatment is over. If you are pregnant, do not use this medication for self-treatment. It should only be used when clearly needed, so be sure to follow your doctor's instructions on how to use the applicator to insert this medication. It is also important to discuss the risks and benefits with your doctor. If you are breastfeeding, consult your doctor before using this medication to ensure the safety of the drug for your baby. When using Monistat 7 cream with applicator, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. This includes prescription/non-prescription drugs and herbal products. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Be sure to consult with your doctor before starting, stopping, or changing the dosage of any medicines. One product that may interact with Monistat 7 cream with applicator is warfarin. Always be cautious and consult with your healthcare provider to ensure the safety and effectiveness of your treatment. If this medicine is swallowed, it can be harmful. If someone takes too much and experiences severe symptoms like passing out or difficulty breathing, it's important to call 911. Otherwise, contact a poison control center immediately. In the U.S., residents can call their local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. It's important not to share this medication with others. To help prevent vaginal yeast infections, make sure to dry the genital area thoroughly after showering, bathing, or swimming. Avoid wearing tight jeans, nylon underwear, pantyhose, a wet bathing suit, or damp/sweaty exercise clothes for long periods. It's best to wear cotton underwear and change it daily. If your sexual partner experiences symptoms, it's important for them to contact their doctor right away. If you forget to use Monistat 7 cream with applicator, use it as soon as you remember. If it's almost time for your next dose, skip the missed dose and use your next dose at the regular time. Do not use a double dose to make up for the missed one. Make sure to store Monistat 7 cream with applicator at room temperature and keep it out of reach of children and pets. Do not flush the medication down the toilet or pour it into a drain unless instructed to do so. When the product is expired or no longer needed, be sure to properly discard it. Consult your pharmacist or local waste disposal company for guidance on how to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.